Hello and welcome back to Your Therapy Guide, a podcast created to help you navigate your therapy journey. I'm Dr. Yadegarfard. In this episode, I'll explain a key module that informs everything we do in therapy, from assessment to intervention. It's called the Biopsychosocial model, and it's a way of looking at mental health that considers the whole person. The Biopsychosocial model is a simple but powerful idea. It says that your well-being and mental health are a result of a combination of three major factors: biological, psychological, and social factors. None of these factors alone can fully explain a person's mental health. They all work together and influence each other. Think of it like a puzzle with three pieces. To get the full picture, you need all three. When we begin therapy, we look at all three of these areas to get a complete understanding of what's happening in your life. Let's break down each factor with some examples. Number one, biological factors. These are the physical aspect of your well-being. This includes things like your genetics, brain chemistry, nutrition, a sleep pattern, and overall physical health. For example, if you're feeling anxious, we would consider biological factors like whether you're getting enough sleep or if you have any underlying medical conditions. It's very important to note that sometimes addressing these biological factors might require consulting with a medical doctor. As psychologist, your therapist, I can assess the psychological and social aspects, but for medical advice, we need to consider whether you need to see your GP. They can evaluate if medication or other medical interventions might be a helpful part of your overall treatment plan. Number two, psychological factors. These are your internal world and personal experiences. This includes your thoughts, emotions, beliefs, past traumas, coping skills, and personality. For example, your anxiety might be influenced by a pattern of negative self-talk, past traumatic experiences, or a tendency to worry excessively. These are the things we often focus on in our sessions, especially through models like CBT. Number three, social factors. These are all the external influences in your life. This includes your relationships, family life, work environment, community, cultural background, and access to resources. For example, your anxiety might be made worse by a stressful job, a lack of social support, or financial pressures. These external factors can create or add to your psychological distress. During the assessment process, I'm not just asking about your feelings. We'll be looking at all three of these areas. I might ask about your sleep habits or physical health, the biological, your past experiences and beliefs, the psychological, and your relationships or work stress, the social. By focusing on all three, our interventions become much more effective. We can work on your thought patterns in our session while also encouraging you to improve your sleep routine and consider a conversation with your GP if needed. This holistic approach helps us create a more complete and sustainable plan for your well-being. Thank you for joining me on this episode of your therapy guide. These short episodes are designed to answer some of the most common questions my clients ask, and I encourage you to listen to other episodes to find answers to your questions. Don't forget to subscribe to this podcast and follow me on my social media channels so you don't miss any future episodes. You can find all the links in the show notes. Until next time, take care.